Let's talk Braxton Hicks versus real contractions because as a doula, this is one of the more common questions I get from first-time parents. I'm going to be talking in this video about what they feel like, how to tell the difference between Braxton Hicks and true contractions, and how you can stop them because they're not always that comfortable to experience. So let's get started. Hi, I'm Ashley and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto area. And I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. Okay, first, Braxton Hicks are named after a dude who was an English doctor specializing in obstetrics who first described these uterine contractions in 1872, and then they were named after him, which is usually what happens when you're the first to kind of discover something. Braxton Hicks can feel different for everyone, but for the most part, they'll probably feel like your uterus is suddenly rock hard, but not necessarily in a painful way. It may feel like your breath has been taken away or like something is almost sitting on your chest, and they can last anywhere from a few seconds to a couple minutes and be really variable in timing, so kind of all over the place and not really something that has a pattern if you're getting a few of them kind of back to back. What they essentially are practice contractions. And we think that they probably start as early as the first trimester, but most people don't start to feel them until the second or even the third trimester, especially for first-time parents. Think about your uterus. It's a large muscle, and so as it gets bigger, you're going to feel these practice contractions a little bit more, and they may get more intense the closer you get to your due date. So what's the point of these contractions if they're not real labor? Well, we think that they help to tone the uterus and prep it for labor, which is why they're often referred to as practice contractions, right? They don't actually do anything to dilate your cervix, but they may help soften your cervix. And if you watch the video on the stages of labor, you would know that you need a softened cervix for dilation and effacement. Okay, let's say you're having a few of them back to back and it's starting to get a little bit annoying and you want it to stop. Well, there's a few things to try. One, drink water. Dehydration is a huge factor in getting Braxton Hicks, so make sure you're hydrated. Not just to prevent Braxton Hicks, but also because it's so incredibly good for you and your baby to be drinking enough water every single day. Another thing you can try is the opposite of whatever you're doing. So if you've been sitting in a meeting for the last hour, getting up and walking around may help to stop them, and vice versa. If you've been really active, resting may stop them. Okay, so now the big question. How can you tell the difference between Braxton Hicks and real contractions when you're actually in labor? Well, there are two major differences usually between Braxton Hicks and real contractions, and I say that with a little caveat because everybody does experience pregnancy and labor differently. And although for some Braxton Hicks are not painful, others may feel some pain when they get them. But for the most part, you'll still feel that tightening of your uterus, but with real contractions, you can expect to feel more pain, and pain that also intensifies. And your contractions with real labor will eventually even out into a pretty predictable pattern. I would recommend going and watching the video I did on the stages of labor that I will link to in the description, because in that video I go through how to tell when you're in active labor by looking at the pattern of your contractions as well as the intensity as kind of an indication that labor is here and it's time to rock and roll. So there you go. That's a really quick kind of rundown of what you can expect from Braxton Hicks contractions. And it's important to note that not everybody will experience them. And if you don't, it doesn't mean that anything is wrong or that your body isn't prepping for labor, because there's a whole lot happening that we don't see and feel. So whether you do or you don't have them is no indication of how your labor will progress. Make sure to grab your copy of your free printable birth affirmations from the link in the description. They're just a fun way to spend some time getting into a great headspace for your birth, kind of relaxing, and you can also hang them around your birth space when the time comes. I'd love to hear your experience with Braxton Hicks contractions, what they felt like to you, or whether you even had any, and if you've been in labor before, also how they compare to real labor contractions. So let me know in the comments below. If you want to know more about doulas or doula tips and tricks, make sure you subscribe and don't forget to hit that like button and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.